Okay, somebody has started this already. Chalo, koi nahi. Let us, because our meeting has got started 8 minutes early.
No, Madhukari ma'am joined.
Not yet, not yet, not yet.
All the best to all the speakers.
Thank you. Thank you.
And we will be starting sharp at 3. Let us wait for the people to join in.
8 मिनट अगर के स्टार्ट मीटिंग प्रेस कर दो
Good afternoon, ma'am.
Good afternoon, Shova. I thought let me join on time.
Good afternoon, ma'am.
Hi, good afternoon. Good afternoon, Sucharita. Good afternoon, Sodamini. So nice to see all the chapter officials. Hello, Ipshita, Pooja.
Good afternoon, ma'am.
Good afternoon, ma'am.
Good afternoon. Who's that?
Dr. Atul.
Dr. Atul. Why can't I see you?
Just a minute. Actually, I'm outside the office right now.
Okay. All right. Good afternoon, Dr. Atul. So I think we'll be able to start on time. People are joining. Yeah. Oh, I can see a group of people also sitting in a few places. That's very, very nice. So let's wait a few more minutes, I suppose.
Yes, ma'am.
We've
We'll
got,
start.
to be precise, another 5 to 6 minutes. So
Right,
let me
right,
go
right.
off the camera for a few minutes. And I would kind of exit by 3:25 because I have to join Noida and Greater Noida chapter ice breaking today. So me and Madhu will step out for a while. We'll come back to your meeting. All right. What is the number of registrations, Pooja?
Ma'am, the number of registrations are 868, and we're just letting them join in 3:10 के आसपास people start.
Sure. Okay.
Yeah, properly. Shall we start, ma'am?
I'm good. Yeah.
Great. So, welcome all of you to the March edition of Ivy Talks. I'm Pooja Swarup Saxena from Polymed, and on the behalf of Polymed and INS India, I welcome you all to the March edition hosted by our new chapter, Odisha chapter. Officials are all there, and I'm sure all of us are looking for this session on DIVA, specifically in pediatrics. So we've got very good number of registrations, and I hope we'll be joining in as soon as possible. Already at 3 we have 50 attendees straight away, and it is getting increased all the way. So as you all know, Ivy Talks is a platform where it's a monthly program, monthly webinar series. We have expertise from across the domains. We have nurses, clinicians, everybody talking about experiences on a specific theme month on month. And in the same series, this month, we are having Odisha chapter hosted by all the chapter officials are present in here in some form of or another. Our chapter head is moderating the session, leading from the front, and we would be starting the session shortly. Along with this, basic rules that we have for Ivy Talks, we would be, raising our hands in the chat box. You can type in your questions if there is any query. Towards the end, we would be also having an open forum. It would be a live discussion. You can use chat box. You can use Q&A box for all the queries that you are having. The backend team would be sorting them out, and we'll bring those questions to the forum as well. Apart from this, towards the end, we would be having a feedback session. So a feedback form would be floated. Would request you all before exiting, please fill the feedback form. With this, without much ado, I would invite for the official flag off our INS CEO, Binu ma'am, to please take it ahead. Over to you, ma'am.
Thank you. Namaskar, everyone. Thank you, Pooja. Thank you, Polymed, at the outset for setting up a great platform for all healthcare professionals to come together and speak about various challenges, solutions, and topics. We've completed 13, 14 months of Ivy Talks. As I speak, I think this is the 14th month of Ivy Talks. And congratulations, Bhuvnesh, Odisha chapter rather. They don't want me to call them Bhubaneswar chapter anymore because they have encompassed that already. So congratulations for hosting this independently for the first ever time. I'm very, very glad to see highest ever number of registrations. 800 plus we have never had. So this is a success story. We know what Odisha chapter can do. And also thank you, Shobha, Sodamini, and Ms. Sucharita for joining. They're all our chapter officials for the state. And thank you, audience, for joining at 3 o'clock on a Saturday afternoon. I will just take 2 minutes to put across the importance of Infusion Nursing Society as well as the importance of IV Talks. So first, IV Talks. IV Talks is a webinar which is hosted on a monthly basis. We choose different topics, and the topic is handled usually by nursing administrators, clinical educators, infection control, quality nurses, instructors, head nurses. Also, it is participated many a times by medical administrators, by specialty doctors, clinical pharmacists, specialist pharmacy, counselors. We have had every stream of people coming together to speak about a challenge. And why we do that is for a simple reason. Patient care cannot be done in silos. It has to be done together as a team. So for all of us, when a patient is admitted, our sole purpose is giving quality care, safe care with minimal errors and with best possible outcomes. So we have to work together. That's why this platform, Ivy Talks, once again, thanking Polymed for that, Dr. Atul, Pooja, and everybody for supporting INS as a partner. Coming to Infusion Nursing Society, we are 15 years old as I speak. So we are into our sweet 16th year of existence. And we have 19 state chapters already, successful 19 state chapters. Each chapter is headed by a chair, a co-chair, there are scientific managers, and there is general secretary. So there's a lot of power, strength in each chapter. We have about 5,000 lifetime members, and we do a lot of programs. Apart from the IB talks, we host scientific agenda meetings. We host different virtual meetings. We do quality improvement programs. One is Inspire, we do along with BD. We do luminary event along with Operating Room Nursing Society. We host skillathons. We host an annual event every year. We host a mid-year event. In the annual event last time we had it in Pune, and Bhubaneswar represented extremely well. We had more than 10 people coming in person from such a far off place. That speaks of your commitment towards Infusion Nursing Society. This time the conference is happening in the city of Ahmedabad. We are final with the date, with the venue. Shortly, the momentum will kickstart by April in setting up the agenda, etc. We have an infusion standard of practice. I urge all the nursing leaders and the nursing colleges who are in this call, please acquire a copy. We have got latest standards of 2025. Please get your copy. If you have to design policies, protocols, SOPs, you have to refer to global standards with an endorsement, with evidence, then you must acquire a copy of the standard. These standards are at a very, very nominal price. It is at 2,000 rupees. And those who are members, I'm glad to give them a 10% discount on the standards. So I request the chapter officials, if you think there is a need and you can promote the standard penetration, please ask us. We'll send you a few copies. We can send you 10 copies to all of you, and you can engage with the teams, with the hospitals, with the nursing colleges, and suggest them to get a copy of it. We also do a lot of competition programs. The competitions will be announced in the month of July, but that is a best abstract, innovation, best paper, best QIP. There are so many awards we give, including the Lifetime Achievement Award, the Safety Award, the Excellence Awards, the Icon Award. The list of what INS does is actually endless. For me, I can remember everything on my tips because I have lived this journey right from day one as a founder member, and it is all etched in my soul, if I may say, not even in my mind. So my passion is that all nurses who come into practice actually get There's certification for IV cannulation, for central line handling, arterial lines, and entire vascular access therapy. We run a lot of programs. Many of these are endorsed, certified by Indian Nursing Council with credit points, and many of these are not certified, but the contents are extremely good. We have an editorial board. We have got an electronic newsletter where I request all of you to send your best articles, the activities you have done for INS infusion related activities. Please create a momentum in the state about infusion nursing society. Unless we all talk about it, unless we engage more people, we will not be able to penetrate further and further across our country. Our country has more than 30 lakhs nurses. We are only 5,000 members. When will it reach the 1 lakh number? Please tell me. All of you have to drive it. And my last announcement for today, knowing the interest of our young population of nurses in the colleges, we are launching from 1st April INS UA for the students. So the students can become members. Membership will start from 1st April. It's getting ready. And INS UA, that means the students of GNM, BSc, they all can become members at a very nominal price. That's about 499 or something, 499, and till the time they complete their final exams, they can stay members. Once they apply for their RN status and they become RNs, they can go for lifetime or 5 years membership on a discounted price. So this is in a nutshell, in brief, about infusion. I'm very glad that you've chosen a topic very, very critical and crucial to nurses and doctors. Managing neonatal and pediatric is really a very tough call. Not everybody can be an expert in the cannulations or the vascular access of pediatric group. Pediatric, we all know, is a vulnerable group, and difficult IV access or vascular access is the topic today. And I see there are some excellent deliberations by all of you, including the stick bundle. I do not know how many of the audience are aware about the stick bundle, but I'm sure the experts in the call today will have a lot of interaction with you. They'll impart a lot of knowledge. You've got Q&A in between. You can put your questions in the chat box. And as I complete my address, we are close to 150 people in the call. That's very, very fast. So Pooja, you were very right. By about 3:10, a lot of people start joining. I'm sure this number will go up. And AP chapter has set a new benchmark for registrations. So it is for us to drive same interest, same energy, and same enthusiasm. So let's do infusion with a lot of compassion. Thank you very much, and all the very best to each one of you for today.
Thank you. Thank you so much, ma'am. We also have Madhukari ma'am here, President INS India. Madhu ma'am, you would like to share your words of encouragement for all of us?
Good afternoon, everyone. Good afternoon, ma'am. And
Hi,
all
Madhu.
the all the Odisha chapters officials. This is the most vibrant and active group chapter that I have seen so far. And thanks, Polymed, for hosting it every month. This gives us a lot of encouragement and knowledge enriching session. This is for everyone, whoever is attending, that we have this session for learning good things. And today's topic, as Ma'am Binu ma'am said, that it is really a very apt topic, and today challenge every time for difficult IV cannulation for pediatric population. This is a specific age population where we have challenge despite all the expertise and everything that we have in the system. So with that, and that too, you are keeping a component of compassion is very effective, because compassion is required, because this is the age group where parents are also very difficult to handle, because we may not be able to do in first attempt. We will be needing more and more attempts, where parents become another population for us to handle for this type of their children to have cannulation done. So whether it is emergency, whether it is in the ICU or whether it is in the pediatric ward, everywhere we have challenges. We have different sorts of people to handle with. So, and parents are most difficult to handle in that case to convince them. I have seen that some of the parents, they don't want child to be crying so much because of cannulation. They have taken discharge, DORB and gone, discharge on respond and gone. They don't want that sufferings for the baby. So this also happens. So it is very difficult situation for nurses to handle. So this is a very apt topic that you have taken, and I congratulate each one of you, the entire chapter officials, for hosting it very well. And we have good participants, so I'm sure it is going to be a very, very enriching session for all of us. Thank you so much once again from INS. Yeah, and Madam has already spoken about INS, so I don't need to add anything. Thank you, Madam.
Thank you so
Thank you
much,
so
ma'am.
much. My new tagline for 2026 will continue to be Infusion with Compassion.
Yeah.
So with this, officially, I would like to hand it over to Shobha ma'am to please take it ahead from here. Over to you, ma'am.
Thank you, Ms. Pooja. It's really an very good opportunity for us. A very good afternoon to all who all are connected in this virtual session today. Respected all the national leaders, INS leaders, Captain Madhukuri Rai, ma'am, CEO, INS India, Colonel Binu Sharma ma'am, whose leadership always talks, and Madhukuri ma'am, she is the president INS India. She told me morning that ma'am, I will be connecting just before time so that I can see whether things are going right or not. Thank you, ma'am. And all the in all the other INS leaders who all have joined today in this virtual session. Miss Pooja Swarup, you are really nice that always connecting with us that how we can do this IV talk session. All the nursing leaders from different hospitals and nursing colleges of Odisha and other states who have connected with us today. All the speakers, Dr. Soumya, the Assistant Professor Department of Pediatric IMS and SOM Hospital. I just called to the HOD of Pediatric Department, Professor Dr. Mamta. She told I'll give you a nice speaker, Sobha madam, don't worry, I'll give you a nice speaker. Thank you ma'am for giving us a nice speaker. So we listen from her. And the leaders of different departments, you can see the some administrative people also joined, many doctors have joined today ma'am. And this is a very good opportunity for really taking this session, math session of IV talk. And today's topic is about DIVA, difficult access in IV for pediatrics. Ma'am, I'll just tell you, before some days, my brother's son only admitted, not admitted, he came for to OPD, and he has having fever for 7 to 8 days, and doctor has written everything for all the investigations like MP, ICT, the blood culture, DC, LC, everything he has written, and he might have to take not less than 8 to 10 ml of sample. So I was also thinking who will take the sample, who will collect the sample. And luckily we have the IV champions from where we got the one of the ANS who has did it nicely in one prick. And you can say the father, the parents were so happy. And this type of things like in IV talks, this is an opportunity, this is a platform where we can share our thoughts. We can think about those little children who all are there, comes to us. We need the compassionate care. We need the parents to be like they are very panic in case our sisters or our nursing staffs are not getting IV cannula in fast prick. This is a very challenging topic. And as Binu ma'am has pointed out regarding DIVA and regarding this bundle, so it is also a the speaker will say about those bundles and how we can target our these children and we can get this fast prick success as well as the care and the compassionate care and managing the difficult access cannulation. And I will not leave. I really feel honored that all the Odisha nursing leaders have given me this opportunity to welcome you all, and welcome all the leaders, all the chapter heads, all the persons who all have joined today, and my dear nursing officers for joining us today. And I think it will be a very good chapter, and it will be a very good IV talk today, so that people will learn something and they will take home messages, so that they can manage those children, those pediatric patients nicely, for pricking a cannula in fast time, and managing those complications which will come in future. So thank you all, and welcome you all once again to this chapter, to this IV talk session. And I will not I will not forget my administration, who has supported us always a lot. My medical superintendent, Professor Dr. Pushpara Samantikar, when I said, sir, we need the IT support, he said, yes, you take. That many people have registered, madam. Not only the nursing, the doctors, the administrators, the nursing officers, everybody has joined today to listen from the speakers. And we have the very efficient speakers today, all the senior speakers and all the experienced speakers are there. So I'll not take much time. Just This managing DIVA pediatric is not just about getting the line in, it's about balancing the technical expertise, patient safety, and compassionate care. So I welcome you all to this session, and we'll start with the first session. I'll not take much time. So I will start this session. Ms. Saudamini Sau, Nursing Superintendent Care Hospital. So please start your session.
Thank you, Soha Madam, for this introduction. My screen is visible.
Yes, ma'am.
Okay. Respected Vinu ma'am and Madhukari ma'am, Miss Pooja, and all my senior and junior colleagues, I welcome all of you for the Odisha chapter IV talk, and feel privileged to get this topic to present. So, welcome you all and a very good afternoon. So my name is Sodamini Sahu. I work as a nursing superintendent for Care Hospitals Bhubaneswar. And I'm going to speak on comfort care and confidence, pain management and psychological support for children and parents. So comfort care and confidence, it represents a holistic approach to patient care, particularly in children. And also it emphasizes elevating physical pain, providing emotional support, and fostering a trusting environment that empowers patients and families. Providing comfort, care, and confidence in child care units involves building a secure foundation through consistent routines, empathetic care, and unconditional positive enforcement. When we are speaking about pain management, pediatric pain management is a comprehensive multidisciplinary approach to assessing and treating pain in children from neonates to adolescents, often treating pain as the fifth vital signs, as all of us know. And children often experience fear, anxiety, and pain during medical procedures. As we are speaking about DIVA today, so this is most important part where patients experience a lot of pain. And all of us knows that pain management is the key component in pediatric care, and psychological support improves cooperation and recovery. Why pain management? Because uncontrollable pains always causes stress and trauma. It may increase a child's heart rate and blood pressure. It creates fear of hospital and procedures. And if you do pain control properly, it improves healings and trust. Before doing pain management, it's very important for a nurse that they need to understand the types of pain as well as how they need to assess the pain. So when we are talking about pain in pediatrics, of course, it is first comes procedural pain. It is IV insertion and blood sampling. Any child gets admitted in the hospital, they have to first goes through to put a lifeline, that is IV line. And we know that how difficult it is for a nurse to get it done, and it is very important that we need to understand how we get it done and which environment we should get it done so that the child experience comfort as well as the parents. The other pains also what the child experiences post-operative pain, disease-related pain like infection and injury. So pain assessment. Every nurse need to know how to do a pain assessment before managing the pain. There are two types of reports when there is a child for pain. First one is self-report, the other one is other reports. Self-report, there are many tools what we use in pediatric care. One is visual analog scale, fact pain scale, and other reports what we receive is from parents and staff when they report about child's pain. The first tool what we use for pain assessment is a flag scale, which is F stands for face, L for legs, A for activity, C for cry, and C for consolability. And the scores are 0, 1, and 2. And in face, if you want to score, if there is no particular expression or smile on child's face, then we score it 0. And if there is occasionally grimace or frown, and withdrawn and disinterested, then we score it 1. And if there is a frequent to constant frown and clenched jaw or quivering chin, then we score it is 2. So the score from the flag scale score is from 0 to 10 is there. The second pain assessment tool what we use is Wong-Becker faces scale, and it is used in children aged between 3 to 18 years of age and depending of their cognitive ability. This scale also is from 0 to 10. Otherwise, we say it is a facial analog scale, where by child's facial expressions, we can score the pain. So if the child is no hurt, we can say smiley face, we score it as 0. And you can say crying face here, we say that it hurts a worst, and we score it as 10. The third pain assessment tool, what we use in our child care facility is numeric rating scale for older children. And it can be used in children aged at 8 years and older based on the cognitive ability. And here the scale is from 0 to 10, and 0 is no pain, 5 is moderate pain, and 10 is the worst possible pain. Here the child verbalizes that how much of pain he or she is having. So these are the pain assessment tools what we use in our pediatric care. So how do we manage our pain? Definitely there are two types of pain management. One is pharmacological and another one is non-pharmacological. And in pharmacological pain management, analgesics are used like paracetamol. For children, we can use syrup, tablets, and injections. Sometimes NSAID is also used like ibuprofen for the pain if it is moderate pain, and opioids are used for severe pain. And whenever there is a pharmacological pain management, the nurses' roles are very much vital. They need to follow trend rates of medication administration and administer a correct dose of medication. And they should monitor post-administration and document it correctly after administration. When it is coming to non-pharmacological, distraction is the best way to address the children's pain. So we can provide toys and cartoons. Now all the children see cartoons in the iPads. So we can use some of them to distract their attention so that the pain is get reduced. If it's little bit older children, we can tell them to do deep breathing exercises, or we can teach them. Play therapy is one of the most important thing, so that in pediatric ward we have play areas where children can be get engaged to reduce their pain. Music therapy definitely helps a lot, and comfort positioning is the best to reduce the pain. Along with that, the most important part, it is psychological support, which actually gives comfort to the child as well as they feel confident in our care and feel a safe environment. So whenever we are going to do a procedure, it's very important that, dear all healthcare providers, it's time for hand hygiene. So it is very important that we explain the procedures to the child in a very simple language. And it is very important to understand the nurse that to allow the parents with the child so that the parents' presence also make the child comfort. and provide reassurance saying that you will be all right, or we can assure the child that you will be all right, and a little bit of comfort we can use for them. And always maintain a child friendly environment so that they uh, allow you to do whatever procedures you want to do for them. Psychological support not only for children, it is always important to parents. Parents has to be a part of children's care, so it is important that we take care of the parents. So the first thing what a nurse can do, it is provide a clear communication. The parents has to be communicated clearly that what procedure you are going to do, whether you are going to put a IV line, for what you are going to put the IV line, what is the benefit of that, and how important it is. That clear communication has to happen. Then educate about the procedures. We need to always tell to the mother or father saying that I am going to put a IV line because I'm going to give important medications to the child. I'm going to give fluid administration because the child is badly dehydrated. All those education also required. We know that our parents are now very much educated, so a nurse has to be equally educated to explain about this. And we need to offer them emotional space, saying that if they are very much anxious and all, to answer them repeatedly if they are asking same question 2 to 3 times. Encourage participation in care. We can ask the mother like to hold the child, to be with the child, hold the child's hand. All those things we need to make the parents to participate in the care, because as we understand that however medication you give, this psychological supports, making them comfort, all those only takes a long way in patient child care. So what is the role of a nurse to comforting the parent as well as the child? Uh, they all the nurses need to know how to assess a pain, so that they can take care of the pain properly and monitoring of the pain. Safe use of medication administration, definitely it is most important role. Monitoring after medication administration, and also the most important is reassessment of pain. Even you give a pharmacological, non-pharmacological, or a psychological support, every nurse need to reassess the pain, saying that whatever activity you have done, how much it has been helped the child and how much pain has been reduced. Providing emotional support both to the child and parent, clear and effective communication with the parents, which is very much important, and creating safe environment so that the child feel confident with the nurses as well as the parents feel confident to leave their children in the care of a nurse. Key takeaways are effective pain management. Always it is essential in pediatric care, and psychological support improves child's cooperation as well as parents' cooperation, and compassionate nursing care ensures better outcomes. Thank you so much. Thank you so much. Any questions I will take. Shobha madam. So, I can say
This was a nice presentation actually. She's having a lot of experience and in clinical area as well as managing the staffs, managing the patients. Thank you, Sodamini madam. This was a nice talk. Any questions can be from the audience, or we'll take it in the end? We'll take
thank
at
you,
the
Shobha
end.
madam.
We'll take it in
Thank
the
you all
end.
for patiently listening to me.
Our next speaker. Yeah, our next speaker is Dr. Soumya Biswa, Assistant Professor Pediatric Department, IMS and SOM Hospital, Bhubaneswar. So her topic is overcoming pediatric vascular access challenges from fear to success. She is the MD in Pediatric and Assistant Professor at IMS and SOM Hospital, Bhubaneswar, with expertise in pediatric critical care and pulmonary medicine. Am I audible?
Yes, ma'am, you're
Am I
audible.
Yeah, yeah. She's trained in NALS and PALS and NRP and has several publications in various journals. So I welcome Soumya ma'am. Just a minute. I welcome Soumya ma'am to just present your topic.
Thank you. This one. My slides are visible now.
Yes,
Am
ma'am,
I
they are
audible?
visible.
Yeah, it's visible.
So, good afternoon, everyone. Uh, Thanks to IMS Farm Hospital Nursing Department for organizing such a wonderful CME and making me the part of this program. Today, I will be speaking on overcoming pediatric vascular access challenges from fear to success. How many of you faced nervous and inconfident before securing a IV cannula? Perhaps all. Securing IV cannula in children are very stressful and challenging job because of their difficult vein anatomy and their uncooperative nature and previous multiple venous attempts. Giving a IV cannula in children is actually art. To be an expert IV cannula specialist, you have to acquire certain skills to acquire knowledge about the pediatric vein anatomy, and also you have to do a lot of practice so that you can convert your fear into a success. So what we will discuss today, what are the challenges associated with pediatric IV access, and most importantly, how you can overcome them. So before that, we should know why IV access is needed in children. IVSS is required for delivering fluids, medicines, blood sampling, and emergency resuscitation. But if you do not able to cannulate the vein in a timely manner, it leads to delayed treatment, pain and lot of suffering to the child, and loss of trust from the parents. So let us know what are the challenges we all face during a IV cannulation. Parental anxiety and pressure is the most important challenge we all face because seeing their distressed, crying child, every parent feels anxious, irritated, and sometimes they become violent and create interference to our procedure. And as such, child are very uncooperative. They move suddenly, they resist, they cry. So even if the cannula is not difficult, they make the cannula difficult one. And as such, their veins are less visible and palpable compared to adult. And during emergency situation, the time is important. So we feel nervous. Also, we have emotional empathy for the children. So if first attempt is not successful, trying for the second is even more challenging, and we felt happy to do a second attempt. If you succeed in the first attempt, it will cause less trauma to the child and improve the treatment efficacy, build caregiver confidence, and reduce the complication to the child. We are talking about child cannula is difficult in children. So why it is so? Because they have smaller veins, they have excess subcutaneous fat, so making the vein less visible, and they have fragile veins also, uh, which increase the chance of double puncturing the vein while cannulating. And they come to us with some illnesses like dehydration and shock, which make the vein collapse. Also, it is very difficult to access these veins. So many times childs are uncooperative, they move suddenly, even making difficult, further adding to the difficulties. And many times they come to us with multiple previous IV attempts. So we get less suitable vein for cannulation. So after knowing all these challenges and difficulties, we should now know which child, means we should predict which child is going to have that difficulty. It is called a score called difficult intravenous access score, which is a simple clinical tool to predict the likelihood of difficulty in securing IVSF and improve the first attempt success. It considers these parameters like veins, if not visible, the score is 2. If veins are not palpable, score is 2. If age is less than 1 year, the score is 3. If age is between 1 to 2 years, score is 1. And if there is history of prematurity, score is 3. Maximum score is 10. Higher the score means higher is the chance difficulty. So if higher DIVA score is 10, so you have to plan, like you have to involve the experienced staff. You have to use brain visualization devices or consider alternate access like intraosseous route, central line, or any nasogastric tube jolt. After knowing all these, let us know some common mistakes we all do, like poor venous assessment and seeing the procedure, wrong site selection, improper fixing or stretching, multiple blind attempts by the same person, and ignoring pain or anxieties. How to succeed it means for a successful vein cannulation, I will tell in orderly manner how we will succeed it. First and foremost is the family counseling. We have to counsel the family well why the child is needing the IV cannulation and what are the complications associated with it, and allow them the parent presence. Second, calming the child. We have to calm the child. If child is small, we can give sugar solution. If the child is bigger, we can show them toys or videos to distract the child, or we should apply some topical anesthetic over the cannulation site if possible. Third, we should keep all the equipments ready before the cannulation procedure, like your saline floss, your Tegadol, your blood sampling bottle. You should not tell your colleagues you have inserted cannula and you are ordering your friend to bring the sampling bottle or Tegadol or saline floss. This should never happen. Then choosing first decrease their movement. How you can decrease their movement? If in case of smaller child, you can do swaddling, and in case of bigger child, you can gently restrain the child. Then choose the best visible and palpable vein, which cannula size. Because cannula means smaller, you should not use a larger cannula. And according to need of the patient, you should use the cannula. Suppose child is needing only IV fluid and antibiotics, so you can use smaller cannula. But if child needing blood products or resuscitation, you can use a bigger cannula and bigger vein. And suppose, and also if vein is not visible or palpable, you can make it visible or palpable using certain technique like applying tourniquet proximal to the insertion site and giving warm compression to the vein and gently tapping the vein. And while cannulating, to stabilize the vein, you can stress the vein a little. Uh, while inserting, insert in proper angle like 10 to 30-degree angle. And after inserting to the vein, you should lower down your angle and go parallelly and advance very slowly. After all this step, we should secure the cannula properly by a tegaderm and a scale below it, so that the vein will not dislodge and vein it will not move, so that complication of the child will be reduced. I will advocate parental presence during IV access because it has lot of advantage. It will reduce the child's anxiety, build trust with the parent, improve cooperation from the child, and increases the fast attempt success. But when to limit their presence? In case of emergency or highly distressed parent interfering with the procedure. So finally, the strategies for successful IV access, you should remember it as success. S for site selection, choose the best visible and palpable vein. U, use of aids like tourniquet, warm compress, and vein finder. C for comfort and calming, using distraction or allowing parent presence. C for correct technique, proper angle, stabilization, and gentle handling. E for experienced, help escalate if difficulty is anticipated or high DIVA score. Then S for secure properly, good fixation to prevent dislodgement. S, stop after 2 failed attempts. And 6, senior help and consider alternatives. So this is the vein finder device we use. These are some key home tips, like we can just by simple corrective steps, we can make a big difference, like allowing parent presence, distraction, using proper position, and securing the IV cannula. Thank you.
Thank you, Madam Soumya, for the nice presentation. And what are the strategies you explained? I hope the our nursing officers could have been understand it well, like how to find the vein, how to like calm the parents as well as the patients. So it is really important for them. And this DIVA score you said, so that has to be obviously followed. Thank you so much. And just from my side, one question is, for anxiety, what will be the best method to apply or to do?
For parent or child?
Reducing the anxiety, both
Anxiety
parents.
Anxiety, if smaller child, you can use, you allow parent presence. You can keep the child in mother's lap, means or parents' presence is important, and give some sugar solution to calm down the child. For smaller child, and bigger child, you can distract them, showing them toys or playing with them. I think, and think this can be done.
Okay, thank you.
Soumya ma'am, you can unshare your slides.
Okay.
So yeah, our next speaker is Miss Padmavati Ji, Nursing Supervisor, SOM Ultimate Medicare, Bhubaneswar. Her topic is stick bundle, standardizing the pediatric IV safety. So she is a post-basic nursing professional and AHA certified BLS and ACLS instructor. Currently, she is working as a nursing supervisor in SOM Ultimate Medicare Hospital, Bhubaneswar. So she is experienced with, earlier she also worked with some many corporate hospitals. So I hope her session will be also very interactive and good session for, and it will be definitely will be a learning session for all of us. Miss Padmavati?
Yes, ma'am.
Yes.
Can you see my screen, ma'am?
Yes, yes.
Good afternoon, ma'am. Thank you so much, Sopa ma'am, for such a wonderful introduction about me. This is the first my online webinar which I am presenting today. Good afternoon, all my elders. And then good afternoon, myself, Padmavati, working as a supervisor in some ultimate Medicare and then BLS, ACLS, AHA instructor also. Today, I have been honored by CNS Miss Aisha ma'am, who have been given a great platform to educate healthcare providers on the importance of IV cannulation in pediatric patients. So today's as our theme is difficult, DIVA, difficulty IV access in pediatrics. More than a technical hurdle, it is important that test our clinical judgment, precision, and empathy. Each failed attempt increases the pain, anxiety, and risk, reminding us that success is not just about the access, but its child overall experience. So let's move into the next session, next slide. Introduction. Intravenous IV therapy is most commonly performed procedure in pediatric healthcare. It is essential for administration, as previously Madam said, it is administration of the medications, blood products, and then parenteral nutrition, IV fluids, and in hospitalized children. Pediatric patients are more vulnerable than adults to related IV related complications due to small veins, fragile skin, and limited ability to communicate their discomfort. Common complications which occurs with the IV is pain, and then infiltration, extravasation. As we know, for all the IV which they are having, we need to face so many complications such infiltration, extravasation, phlebitis, dislodgement, and then infections. These complications may lead to pain, tissue damage, delayed treatment, prolonged variations, IV insertion techniques, monitoring practices, and staff training. We all needs to practice here the stick bundle. That is the main topic of today's. So stick bundle is the, we'll move into the stick bundle. Today is my topic is stick bundle, which is we are going to see now and then practice it in daily basis. Strict bundle is a structured safety bundle which is designed specially for IV pediatric therapy and is based on the evidence-based practices which focus on the IV insertion and ongoing maintenance, which helps us reducing variation in clinical practices and promote safe, constant, and high quality IV care. Stick bundle test prevention of common complications, which we have been seen in the previous slide, which is the infiltration, extravasation, and then phlebitis infection. And it emphasizes early detection and timely intervention. It integrates assessment, technique, monitoring, and then documentation. Now let's discuss about the components of stick bundle. Yes, yes indicates site selection and skin preparation. Whenever we will choose the site, we need to choose the appropriate vein for the pediatric patients as per their age and then therapy duration. We need to know the which type of injections we are going to transfuse for the baby. Then which size we need to take care for that baby to do the IV cannulation. We need to avoid the joints. Previously, if you have been used for pricking, we need to avoid that part also. Always remember to perform skin preparation before you are doing the IV cannulation. Next, we will move into the technique. S indicates, already I have been told, it is a site selection and skin preparation. Now we will move to the next, performing cannulation using technique, which is second component of our stick bundle. After selecting the vein and performing the skin preparation, we move to technique of performing the cannulation. Whenever we are doing any procedure, we need to do the hand hygiene by using all the steps. Use appropriate catheter size for pediatric patients. Use evidence-based insertion techniques. If you can use vein visualizations, as Madam said in the previous slides, so if you have in your hospitals, as per the protocol, you can use the vein visualization tools when it is available. Confirm correct labeling and documentation also is required to visualize that IV site. Next, we'll move into the component of, this is the cannula size I have been given for the reference. Most of the time for the pediatrics, we'll go for the 22 and then 24. Next is infection prevention. S indicates site selection, skin preparation. T is technique. Now we'll move into the I, infection prevention. After performing the cannulation, which correct technique and selecting the transparent dressing, we need to prevent the infection. Infection can be prevented by maintaining skin antisepsis before and after the procedure. So whenever we are doing the cannula, before doing the cannula, we need to prepare the area by using center to peripherally with the sterile alcohol swab as per your hospital protocol. Secure the transparent dressing after the procedure. Regular inspection of the IV site for signs of any infections, swelling, redness. We are going to discuss that slide in the coming slides. It is important to identify the complications early. If anything you have been found, we need to remove the cannula and we need to go for it next. And the next is C indicates catheter care. So we need to stabilize the catheter by using some transparent dressings and then some splints, because the children are more movable. There will be more chances of catheter dislodgement. That's why we need to be stabilize the catheter properly. Maintain catheter patency with proper flushing protocol by using ACL, assess, clear, lock. Secure the catheter with appropriate dressings, which we are using the transparent dressings. We can easily visualize everyday basis whether is there any leakage, swelling, redness. Monitor for infiltration, phlebitis and dislodgement. Monitor infusion rates and medications carefully, whether we are giving in a proper way or not. The last component is keep monitoring. We need to do frequent assessment of the IV sites and document it every day in the nursing notes. We need to document how the IV sites it looks and then whether it is patent or not. Then we need to educate the caregivers about the signs of complications. then can give prompt response to the complications, and also we need to educate parents and then caregivers how we need to take care of that part. Then let's move into the VIP score. So in daily basis, whenever we are going to see the child, we need to use this VIP score and then tell them how the cannula was, whether it is a healthy, is there any signs of phlebitis, what was the score. If the score is, everyone knows, if it score is, we will use a phlebitis score is 0 to 5. If it is 0, the cannula was healthy, you need to only observe. If it is 1, any signs is present, pain or redness, we need to calculate as a 1. In this also we will only observe it. If it is 2, pain, erythema, swelling. In these 3 signs, any 2 signs are evident, then we need to resite the cannula and then observe that part. The 3 is pain along with the path of the cannula, erythema and induration. If present, we need to resite the cannula and then we need to consider the treatment, whichever is required. The 4 is all of the following signs, evidence and then extensive. Pain along the path of the cannula, erythema, induration, palpable vein cord. In this also we need to resite the cannula and then consider the treatment. Number 5. All of the following signs are evident and extensive. Pain along with the path of the cannula, erythema, induration, palpable vein cord, and then pyrexia. In this also, we will be reset the cannula and then patient will be developed as advanced stage of thrombophlebitis. We will not wait till the score is 3. When the score is 2, we need to remove the cannula and then we need to go for another cannulation. Next is conclusion. Implementation of standard care like stick bundle. So by implementing this all the stick bundles, we can reduce IV infiltration and extravasation injuries, decreased pleurisy, which is peripheral line bloodstream infections, improve patient comfort and safety, enhances clinical documentation, promotes team communication and accountability. By using this all the stick bundle, we can also keep the IV sites of the baby healthy and then daily monitoring of the IV cannulation also is required. So by this conclusion, the stick bundle has been finished. Thank you so much for everyone for giving a great platform to present this. And then if you have any doubts, you can ask me. I'm going to clear it. Thank you.
Thank you, Ms. Padmavati, for your nice presentation. And whatever you have been touched, the very important things like site selection, the techniques, and very importantly, the infection control part, like cleaning the area and site preparation. And also, the very important is transparent dressing, by which the nurse or the healthcare worker can identify the complications easily. If there is any swelling, any redness, pain, so it can be identified. Very nice presentation it was. I hope all the audience could have been learned many things. Those are the very basic things, but repeatedly remembering them, repeatedly doing this will be increasing their skills and practice. So thank you so much for presenting this nice topic. So we'll keep the questions in the end. Is it okay? Pooja madam, is it okay? Yeah.
Yes, ma'am. Perfectly fine.
Yeah. The next speaker is Ms. Subhasri Mahanti, DNS, IMS and SOM Hospital, Bhubaneswar. She is the Deputy Nursing Superintendent of IMS and SOM Hospital. She is having more than 20 years of experience, and she was mostly working in the NICU and pediatric ICU, and hopefully she will have the very practical knowledge of pediatric IV cannulation and difficulties in IV cannulation. Her topic is pediatric IV complications, prevent, detect and manage. So welcome you Subhasri Mahanti for presenting your topic.
Thank you so much, ma'am. Myself, Subhasri Mohanty, Deputy Nursing Superintendent, IMS SOM Hospital, Bhubaneswar. Small vein, big responsibility. Because in pediatrics, even a teeny mistake can have a big impact. Respected dignitaries, esteemed INS India, INS Odisha officials, especially to my nursing superintendent, Ma'am Minati Mishra Ma'am, and additional NS Madam, Shobha Manjari Samal Madam, who is the chairperson of Odisha chapter and honorable moderator of today's session, for giving me this opportunity to present in this important forum. Namaskar and a very warm good afternoon to everyone present over here. I feel truly honored and grateful to INS India and the Odisha chapter for giving me this opportunity to present on this national platform. My sincere thanks to all respected officials and organizers for this wonderful initiative. Today, I will be speaking on pediatric IV complications, detection, management, and prevention. IV therapy in children demands extra vigilance due to their fragile veins and higher risks of complication. Early detection and proper care can make a significant difference in patient safety and outcomes. Through this presentation, I aim to highlight key complications and practical strategies to prevent them in our daily practice. So without any further delay, let's begin today's session.
Subhasri, your slides are not moving.
This one. Introduction. IV therapy is common in pediatric care. Children have fragile veins and sensitive tissues and prone to injury. Early detection of complication is essential. Proper nursing care prevents most of the complications. Common pediatric IV complications: phlebitis, infiltration, extravasation, infection, occlusion, air embolism.
The slide is not visible.
It's visible.
Slide visible.
Slide is
visible.
visible.
Yeah, it is visible.
It's visible, Subhashri. Please go ahead.
Phlebitis. Phlebitis is the inflammation of a vein characterized by pain, redness, swelling, and warmth, commonly associated with intravenous cannulation. Types and causes of phlebitis: mechanical phlebitis, chemical phlebitis, infective phlebitis. Management of phlebitis: stop infusion immediately at affected site. Remove IV cannula carefully. Elevate the affected limb to reduce swelling. Types of phlebitis. Mechanical phlebitis. Mechanical phlebitis is inflammation during physical irritation or injury to the vessel wall during insertion. Causes of mechanical phlebitis, catheter movement. When an IV catheter is not properly secured or moves within the vein, it can rub against the vessel wall and can irritate to the vein. A catheter that is too large for the vein or placed too close to the joint area. Repeated insertion, frequent insertion and removal of IV catheter in the same vein. Then prolonged use of an IV catheter. Chemical phlebitis. Chemical phlebitis is inflammation of a vein caused by irritating substances introduced to the vein. Causes hypertonic solution. Fluid with a higher concentration of solutes than blood, that is parenteral nutrition, high concentration of dextrose or 3% saline, because they draw water out of the veins. Cells, they can cause significant irritation and damage to the vessel wall. Certain medication naturally irritating or have a pH that differs significantly for blood, and potassium chloride causes burning sensation during infusion. Some antibiotics such as vancomycin, flucloxacillin are particularly irritating, vesicant to the vein. Then lack of flushing protocol. Infective phlebitis. Infective phlebitis occurs when bacteria or other infectious agents enter the bloodstream. Causes of infective phlebitis: poor aseptic technique during insertion and maintenance, wrong practice during administering IV medications, infected wounds, surgical wounds near the IV line, non-sterile dressing. Other causes like obesity, certain blood disorders, or prolonged immobility can also increase the risk of blood clots and infections. Then infiltration. Infiltration is if the fluid is non-vesicant, like NS 5% DS, does not irritate tissue, is called an infiltration. Infiltration detection: swelling, pool, skin pallor, blanching, slowed or stopped infusion. Infiltration management: stop infusion as soon as possible. Elevate limb, remove IV catheter. Prevention of infiltration: proper catheter fixation, frequent site monitoring. Then extravasation. Extravasation is the leakage of vesicant drugs or IV fluids from a vein into the surrounding tissue during intravenous therapy. Extravasation detection: pain, swelling, blistering, skin discoloration. Extravasation management: stop infusion immediately. Leave catheter for antidote if needed. Notify physician. Extravasation prevention: check IV site regularly. Use correct catheter size. Then infection. Infection is a common complication of intravenous therapy caused by microbial contamination at the insertion site. It occurs due to poor aseptic technique, prolonged catheter use, or improper side catheter. Infection detection: redness, pus, swelling, fever or systemic sign, whole body affected. Then management of infection: remove IV cannula, culture if necessary, start antibiotics is ordered. Infection prevention: strict aseptic technique, maintain proper hand hygiene. Occlusion: blockage of IV line preventing fluid or drug flow, causes neat tubing or limb movement. Block, blood clot or improper flushing. Then sign and symptom of occlusion: infusion stop, pump alarm, resistance during flushing. Occlusion nursing management: check line and repositioning limb. Flush gently, do not force. Occlusion prevention: regular flushing, properly secure IV line. Air embolism, entry of air into the bloodstream through IV line. Causes of air embolism, air in IV tubing, loose IV connection. Sign and symptoms of air embolism, sudden breathlessness. Symptoms can range from dyspnea, rapid heartbeat and low blood pressure, chest pain, cyanosis. Nursing management of air embolism, stop IV immediately. Position, child left side, tendon bird's position, like head lower than the feet. Give oxygenation. Prevention of air embolism. Remove air from IV lining. Ensure tight connection. Length of hospital stay increased due to phlebitis problems. Phlebitis related to IV cannulation during treatment or surgery. Impact, increased length of hospital stay, patient discomfort and risk of infection. Preventive measure, proper aseptic technique during IV insertion, regular assessment of IV site and early detection of phlebitis. Timely removal or replacement of IV cannula. General prevention strategies. Proper IV site selection, secure catheter properly, frequent monitoring, hourly in pediatrics, educate caregivers, use infusion pumps when needed, use strictly aseptic technique during insertion and care, flush IV line before and after medication administration. Then conclusion. Pediatric IV therapy requires vigilant monitoring, early detection, reduce complications. Nurses play a key role in prevention and management. Thank you all for your active participation. I hope this session was useful and if formulative. If you have any question, feel free to ask.
Thank you, Subhasri, for the nice presentation. As I have already mentioned that we will take the questions at the end of the sessions. So please be ready if any questions will come from the audience so that you can answer those questions. And just highlighting your topic, it was about the complications like extravasation, infiltration, hematoma, infection, all those things. When it comes, the take-home message which I found from your slides, sir, it was like just stop the infusion immediately. Whether you see a infiltration, whether you see a extravasation, please stop the drug immediately or stop the IV fluid immediately so that next step can be taken care. And another thing is, as we are the healthcare workers, we are the nursing who is handling those invasive lines 24/7. It is very important that we should be monitoring each shift. Every time we being the seniors of nursing fraternity, we must have to tell all our nursing officers whenever there is any vesicant drug is going on, when there is a continuous infusion, so we must have to monitor in 3 shifts so that there should not be any complication and it will not lead to more than that, which can be like a gangrene of that area. As we have been, there are many examples of pediatric which has gone very pathetic condition due to the extravasation. So thank you, Subhasri, for a nice topic presentation of regarding the complications of IV therapy.
Thank you, ma'am.
So the next topic, so you can just take out your slides. So our next speaker, the last speaker, last but not the least, so that we kept Ms. Sucharita Das, DGM Nursing Apollo Hospitals, Bhubaneswar. We kept you in the last because everybody will be awake and will listen to you. So she is the nurse, as I said, she is the DGM Nursing Apollo Hospitals, Bhubaneswar, with having more than 26 years of experience in care and administration, holding BA, post basic BSc, and MSc in mental health. So she is the certification in Six Sigma, and there are many publications also she is having in infusion safety and liver transplant care. So her topic is about skill meets compassion, building pediatric IV excellence through teamwork. So
Thank you. Thank you so much, ma'am.
I welcome you to your topic.
So I hope everybody is seeing my slide.
Yes.
Yes, Sucharita.
Yes, okay. Thank you so much, audience, to join me in the IB talk. And I will start my topic because this is the topic infusion therapy. It is undergoes with the certain regulatory bodies, which is INS India, and the certain rules regulation are working with the entire infusion therapy across the nation, across the patient care area, wherever we are. So considering the skill meets compassion, building pediatric IV excellence through teamwork, this is the very viable topic which I have taken today, and I will talk about all these the standard of the INS, which is our mantra, that is the INS standard book. So first, I want to consider that the special patients population, which has talked by Madam Madhukari ma'am, yes, really it is a very special population, neonatal, pediatric, pregnant and older adults, which standard is 2 in the INS chapter, and really it is the very important where we are considering the neonatal and pediatric while we are doing the IV cannulation. At the first choice, we need to go with the DIVA identification, difficult vein identification, and ensure that the mother family member are very trustworthy with the nursing manpower and the infusion, what we are going to infuse to the baby, and the everything are known to the mother. So here I want to discuss that what will be the DIVA when the pediatric in considering the neonatal and pediatric. First things, the disease process a nurse need to know, history of the frequent venipuncture happened for that baby or not, it is need to be in consideration, history of the frequent venipuncture, length of infusion therapy, whether baby was the admitted in previous or any organization or not, how many days the infusion therapy has been continued, then variation of skin tone, the baby may be fair, baby may be black, so that is also under consideration of DIVA. Then skin alteration, if the skin is very dry, skin is having any patch, any scars, then that is also another things. Age, neonatal and pediatric, it is a very sensitive age group where we are introducing the IV cannulation. Obesity, if neonatal over obesity is present, another problem for the nurses, and definitely fluid volume deficit. If a nurse is considering this many points for the patient, neonatal and pediatric, I hope that they must consider that is the DIVA. And definitely previous speaker has been described that how to go about. I have discussed 6-7 points, which is each one of them is 111. If you consider in the DIVA score, you can get it easily, which is mentioned in the INS chapter. 22 and 26. Now I am coming to the trust. When the trust is matter for the parents, then definitely it has to be built by a caregiver. And when the trust will come, when the person is having the compassion and the skill of about the INS chapters. So clinical competency as well as the clinical knowledge, definitely it is required when the use of different kind of technology, like use of near infrared light technology, use of catheter to vessel ratio of the lens minimum 45% needs to be there. Device planning needs to be there. There should have a short, long, and midline lengths. All this clinical expertise definitely one nurse should have, then only the trust will come. Now compassionate the care, definitely it cannot be happen within a one day. A nurse need to be gone through various kind of training program when they are going for the IV cannulation. Patient is not a dummy. Dummy needs to be a different. The skill lab needs to provide that novice nurses, where the one hand should contain the different position of the venous line, and nurse should read all these lines before going to the babies and the neonates. Definitely the nurse educator role is here. They need to have the process gap. The educator needs to identify a nurse where the process gap is there. So every nurse has gone through the training schedule, a particular training schedule about the INS chapter. Then there are process gap by the educator, clinical educator. Then performance competency training needs to be with the very clear structured training program. Ongoing continuous clinical assessment has to be with the one nurse before putting the IV cannulation with the baby and the pediatric patient. And definitely there are certain data which we are going to collect. Family parents are very much required to give the family education, parents education about the goal of IV therapy, about the necessity of IV therapy, and where it is required for the long line, short line, even though it is the midline access we need to have with the pediatric and neonatal. Now coming to the teamwork, yes, it is the confident of the pediatrician where he or she is taking care about the child or neonate, where he is recommending the nursing capability building, and he is recommending who can do such what kind of patient IV cannulation. So teamwork is very much required. Family engagement, definitely it is requirement to the easy access to the baby, and the mother who can manage the baby well with the emotions and the other recommended therapies. Now I'm coming to the vascular standard 26 at the vascular access device planning, and we are using the umbilical catheter. Yes, it is the very important chapter in the where the umbilical catheter we are using. We can use umbilical arterial catheter, umbilical venous catheter, umbilical arterial catheter. For the neonates, we are using for the ABG and blood ABG monitoring, and the venous we are always using for the medicine as well as all the blood product, where the bedside nurse is involved, vascular access specialist involved, clinician, clinical pharmacist, treating physician, anesthetist, parents and caregiver, definitely it is the involved. Now when we are putting the umbilical catheter to the neonates or neonates, it is the chances of get thrombosed. So this is the primary responsibility to continue with 0.25 ml to 1 unit per ml continuation of heparin solution, so that the line will be the patent. We should not use even the preparation of the skin, when we are talking about the neonates and the pediatric area, we need to talk to our clinician, because the skin texture may not be considered the chlorhexidine, or it can have a burning sensation. So when we are asking for the skin preparation for the pediatric group age, neonatal group age, we need to be very cautious. uh, Even though the less than 14 days, but we should not use any kind of chlorhexidine in the pediatric neonate skin. Avoid any tincture benzoin co use apply in the umbilical catheters. If even though you cannot use any kind of um, uh, that tube or cream in that area, so there is chances to get the fungal infection. Another thing that it is very important when we are treating the neonates, we are having the umbilical catheter, that when we are say, it is the 5 centimeter catheter which introducing in the inferior vena cava, and it is coming the right atrium, the below junction of right atrium. So when I am withdrawing this catheter, that is the very important phase for the neonates. Each per minute 1 centimeter we have to withdraw the umbilical catheter, and which is very much important to know each of the nurses in this country. Now I'm coming quality improvement. Then if I'm going to improve the quality, so we need to get the, by law, consent is required. Explain the appropriate use of language, it will be required. Definitely prepare the skin, pediatric skin. We have to consider many things which I have discussed. Comfortable position we have to give, manage pain, that is already discussed. Avoid rushed communication, that I am it is not the always requirement that I will be very rush into my process. No, it is a very delicate customer for us, the pediatric and neonatal as well as mother. That is the emotions is involved. So I have to, as a nurse, every nurse should give a minimum time period to appropriate communication. Recognize any distress. If any distress is present, the nurse should recognize its first choice, and they should use the appropriate communication in better manner. Praise and reassure continuously, these things we have to do. And the quality improvement, I should expect that we should identify each adverse event. Each data, quality data needs to be collected. It has to be analyzed. Even though any risk factor or any adverse event is coming with the infusion therapy, it needs to be analyzed properly, so that we can go for the quality improvement. And last, in the quality improvement, I want to tell that each nurse should go with the research, documentation, research and publication, because it will help us to grow further in the infusion therapy process. So team-based effort, if a pediatric nurse, it will give a very good outcome. Assess child, where you understand the DIVA, and therapy also, what kind of therapy you are going to start for the pediatric age group on neonate, that needs to be clarified, and better understanding for a nurse as well as patient and relative with the clinician. Identify access difficult early. So choice of best device, we have to go with the best device. And we need to reduce the complexity. Prepare child and parents accordingly. Insert with proper support, where the every law and rules regulation will be fulfilled. Monitor site and response. We need to see the response of the children, pediatric and neonates, and the parents. Escalate early if needed, and documentation and improve the process wherever it is required. And definitely it is a takeaway key takeaway message that pediatric excellence is required, really technical skill is required, very good knowledge is required. But infusion standard needs to be required always in the hand, where I should consider every standard. Team communication, it is required to reduce any kind of complication. Parents definitely should be in consideration in every and each step, and early collaboration with the every team member can give the best and safer practices. So this is in IV, pediatric IV care, teamwork turns skill into safety, and compassion turn treatment into trust. So we are the nurses, we should build the trust when we are uh, managing our special group pediatrics and neonate. Thank you so much.
Hello, am I audible?
Yeah, ma'am.
So thank you, Ms. Sodavini, DGM of Apollo Hospitals, Bhubaneswar. Thank you for the nice topic presentation. Whatever I saw, it was about trust. So it was about the trust. For the trust, you need to have the clinical skill, teamwork, compassionate care, and your family engagement is also important. And the very importantly, you said about the INS standards. So those are very important for us. We must learn the INS standards. We must go through those standard books and have to learn what are the standards says, how we are going to follow those standards by which we can give the same compassionate care to the patients, and we can get the confidence that the people can trust on us, the parents can trust on us for the, and they can allow the nurses for the IV cannulation, and the nurses also be comfortable to put the cannula in the first prick. So thank you so much for this is the, I think this is the end of the session.
Thank you so much, everyone. Thank you, ma'am.
We can take up the questions, I guess, now, ma'am, from the chat box.
Yes.
You can type your queries, everyone, in the chat box. We will take up the questions one by one. You can ask other speakers also. तब तक जो questions हैं, let us take from there itself. There was one question which was little bit different than the topic that we have taken, but yes, the question has come. I think DIVA score was discussed. So there's a question from over there. Ma'am, as an adult patient, also we find very much difficulty in intravenous cannulation for them. Is there any specific tool like DIVA score? So anyone wants to answer this one? Sucharita ma'am, you can go ahead, please.
See, we are discussing now pediatric age group, but if you see that from the adult also, when adult patient coming to the emergency department, first choice you should ask what is the difficulty, what difficulty you came to the hospital. So everybody taking one difficulty and coming to the hospital, that is the most important. After that, what doctors is asking, what is your comorbid condition? Do you have diabetic? Do you have any other thyroid, any other difficulties? So patient is giving. So to complain, you are already in the adult age group, right? And third, same thing you can take if the adult patient is the blackish patient, can you identify vein easily, rather than it is very easy to fair patient identify the vein. Obese patient, 100 kg, 80 kg weight patient is coming to the emergency. First choice, you are saying, oh, how I will get the IV cannula. So that is the another difficult situation. That is also one of the DIVA. Patient is the bleeded so much. So when there is huge bleeding, the fluid volume loss, or patient is having the loose motion 20 times fluid loss, so that is another DIVA you will get. That patient, you will not get the vein easily. So few such uh, things that you will get from the adult, and it is clearly mentioned in the INS standard where the DIVA is given clearly. So few of the standard just now I spoke about. If you go with that standard 8, will get the clear DIVA picture, and if you put as per organizational um, SOP, organizational policy you are making about the DIVA, if you put one each point, you will get the total score from the INS. So this chapter I am giving you, you please read it, you will get the every details about the DIVA of the adult.
Thank you. Thank you so much, ma'am. There is one question which has come to me in DM. There is one situation they have put in: how to handle a situation where the parents refuse any further attempts of, IV cannulation. The parents are fed up with the multiple pricks, and now they are telling that refusing any further attempt for cannulation. How to talk to, or how to work out with those kind of parents? How to handle the situation?
I think that that is the one of the our difficulties where the incompetence nurse are freaking the baby. That is our problem. I know the baby, if neonates and pediatric, or else even though I am talking about the adult, I know who is the efficient nurse. And that situation will arise when I did not counsel my parents about the DIVA. That time only this situation will arise. So my humble request to each one present in this forum right now, start your DIVA. You will get resolve such kind of difficulties with the parents, because parents before pricking, parents are engaged, parents are counseled that if baby is having the DIVA, there are many reasons I have already discussed. So parents will not be so aggressive, because they have to accept the difficulty of the vein and the difficulty of the process.
I have a question with me. Hello?
Yes, ma'am.
Yeah, this question came for Miss Sodamini, Sahu Nursing Superintendent. Sodamini madam, are you there?
Yes, yes, I'm here.
So the question for you is, how can we reduce both pain and fear in children while supporting their parents during the care? The parents are there in one side, the children are there with pain and fear. So how, being a nurse or being a clinician, how we are going to control both of the things and put a cannula easily?
Okay. I will say that
Question is for me.
Question is
Sodamini ma'am.
for Sodamini.
Yes.
So, Soha madam, you asked me that how we can reduce pain in children, as well as for means apprehension in parents while doing a procedure, right? So I will say that uh, the first place, it is very important that we take care of the parents. We need to give a clear and effective communication to saying them that why I'm going to give a lifeline or a IV line for the child. They are bringing the child to the hospital for a purpose. So that need to be clearly communicated to them, saying that the child is dehydrated, maybe after AGE. Maybe the child need a blood transfusion because hemoglobins are low, so that we need to put a IV line. Maybe there are need a antibiotic because the child, there is a lot of infection in the child. So the first place, it is very important that the parents need to be counseled the purpose of IV cannulation. That is, I think, the first thing need to be done. And the second thing it is that we need to tell them that I am going to give the best nurse who is expert in IV cannulation, who is going to put your child in one chance, one prick. so that they feel comfort, they feel the confident saying that they are going to take care. They always think that the parents think that always whenever they come to hospital, they think that my child is very important, and that how much I'm worried about the child, everyone around also should be worried about that. So that concern we need to show them, saying that I am going to take care of child like my child, and I'm going to give the child the IV cannulation nurse who is the best among all of us. So what happens? They develop the comfort and as well as confidence with us, so that they will allow us to do the child. Second thing, when it is coming to the child, how can we reduce pain? I know that it is very difficult to reduce pain, someone who is getting pricked, but we can do distraction, as I was talking about distraction therapy for the child. So we can allow keep the mother with the child so that the child feels safer. And along with that, we can give some toys to the child, put him in a comfortable position, so that we can comfort them. I think I answered the question.
Yes, yes. So first of all, we have to take the confidence of the parents that we are going to give a nurse who is expert in IV cannula. So
Yes,
at least they will be silent. Yes, my child is in a safe hand. So
yes,
secondly, once the mother or father is being counseled, definitely they can be under control the child, and they can bring the child under control, or the child they can just make the child somehow understand कि they are going to the child can be get pricked for a IV cannulation, and the second one is how important is the cannula for the child for the treatment.
yes.
Thank you so much.
Thank you.
Any more questions from
Um,
audience?
in chat box, we don't see much. Um, okay, there is one thing which I think it has been answered, ma'am. But just one question which has come on the compassion part itself. How can, I mean, some tips they have asked for. How can nurses balance technical efficiency with emotional care, specifically in the pediatrics, if we want to talk about the pediatric setups, because it's very important and you have explained very detail about the compassion in here. So how can nurses balance technical efficiency with with emotional care? I think it is from some student nursing personnel. Still, ma'am, would you please mind answering this one?
Okay. Um, Technical competency with emotional care. Sorry, there are courts are announcing somewhere, so that is the thing. What I will say that how to balance technical competency with emotional care. That's what he says. I will always tell that always knowledge comforts us. It's very important that if you are knowledgeable, you are confident and you can face anything very confidently. So knowledge is first important. Second thing is that skills make you more confident. So knowledge and skill is the first place which need to become, and that's what it is to be about technical skills. So that has to be, as a nurse, we need to be knowledgeable and skillful. Then coming to the emotional part, I understand as a professional that if I am expert and I am knowledgeable and I know how to manage the situation, then there is emotional balance. And there is I will say that you are emotionally powerful to address the situation, because you know that what to speak, what to do, and how to do it. So I would like to say that anybody who is technically skillful is confident and he can create a environment around them to do it much better way. So uh, to become emotional balanced, you need to be knowledgeable and skillful. If you are there, your emotions already taken care, so you need not to bother about that, as I understand.
I guess they have got the answer.
Skill and knowledge both are important. So once you are knowledgeable, definitely you will be skillful by practicing more and more. And with the skill and knowledge, confidence comes, and emotional balance also will be there, and it will be under control of yours.
Yes.
Yeah.
Right.
Self
This is
manage
from
comes
the
first.
experience.
Nicely, you have
Right.
replied very nicely. And
Right.
another
This is
question.
coming for the experienced leaders to the new to the novice nurses who are just in
Yeah.
in the starting of their career.
Just a
Ma'am, one
question for
thing.
Ms. Padmavati, that regarding the stick bundle.
Ha,
Like, why standardization through the stick bundle is essential for safe pediatric IV practices? Should I repeat my question? Why this standardization through this stick bundle is essential for pediatric IV practice? Ms. Padmavati, are you there?
Yes, ma'am, I'm there. Can you able to hear me, ma'am?
Yes, yes.
Thank you, ma'am, for the question. So, by following all the stick bundles, ma'am, we can able to daily monitor the vein site and then see the dressing. We need to know the how to do the technique of the cannulation and then catheter care, continuously monitoring. So by following this all the stick bundles, we can this all the stick bundles are evidence based. We did not take like somewhere else collecting and all. So how we are practicing for all the care bundles for the patient like VAP, CLEPSY, and then this SSI, like that. For these pediatric patients also, they have been developed a stick bundle. By following this stick bundle, we can able to provide patient safety and then continuously monitoring of the IV cannulation site. So we can able to reduce the complications of the IV by following the stick bundles. This is my answer. I hope I can able to answer your question, ma'am. Thank you.
Shobha ma'am, you are mute. You're on mute.
Yes, I was mute. So, so it is important that for standardizing our practice, we need to have some bundle, some checklist, some standardized checklist must be there, which we need to follow, by which we can standardize our practice. The last question from my side to Subhasri Mohanty. It's about, I think her topic was about the complications. The complications about extravasation. If you see that if there is any extravasation for the patient or the baby or the child, this can lead to more and more complication like gangrene of that area. So what are the strategies which need to be followed to control these extravasation? This was the question from my side.
Thank you, ma'am. Extravasation is the leakage of vesicant, like chemotherapy drug, vasopressor drug. So, IV fluid from a vein of the surrounding tissue during intravenous therapy. Use proper vein selection, avoid joint area, secure cannula oil, and check patency before starting infusion. Monitor site frequently for pain, swelling, redness. Stop infusion immediately if suspected. Use appropriate dilute rate for the irritant drugs and prefer cannula line.
I think some network disturbances there at her end. It's
Thank you.
Yeah. So what she was trying to tell is dilution must be correct. What are the second drug, chemo drugs should be dilution should be correct, and it should be monitored in 3 shifts. Where there is any signs of extravasation, so the nurse or the staff must remove the cannula or stop the drug immediately, so that it will not cause more harm to the patient. Thank you so much.
Thank you, ma'am.
Ma'am, we also have Dolly ma'am in here from the INS Scientific Committee, and Harvinder ma'am is there from the founder members INS India. Maybe we may want to hear something from their side. Ma'am, either of you can please, before we officially go for the formal vote of thanks. Dolly ma'am, if you're there.
We are not able to see, ma'am.
Yes, we are not able to hear as well. One second, let me see. Okay, so might have got on some call or something. Harvinder ma'am, you are there? I think they are on some call or something. Ma'am, we can, I think, proceed further. In between, if they join in, we'll get it.
Okay. My battery is low. Just a minute. I don't know what happened.
In the meantime, for all the attendees, Ms. Ipshita, she has posted the feedback link in the chat box. Please do not exit the meeting without filling the feedback form. Okay, Dolly ma'am is here.
Yes, Pooja, anything you would like to say?
Nothing, ma'am. I was just asking the participants about the feedback form. And as Odisha chapter, we all want to hear from your side on the overall webinar today, Ivy Talks.
Yeah, absolutely. Because this is, wonderful speakers and very well organized, and all the messages, whatever you have conveyed, it was really like Saudamini and Sucharita. Shobha has coordinated very well. Soumya, they all have spoken really excellent talk. Everybody has given, and I congratulate the Odisha chapter, those who have taken all the efforts to conduct this webinar with very thought-provoking topic. And this difficult intubations, it's not a problem of one or two organization, but every organization are facing. You people have dealt with the pediatric cannulation difficulties, but truly speaking, even if you look at the adult populations with debilitating conditions, chemotherapy, receiving therapies continuously for long period of time, are also having this kind of difficulties. So even I was just, when I was looking at this success acronym, it's written after 2 prick, you just stop. You don't go for another prick. So I say to my nurses here that 1 prick only you try. And if you are failing, then you just call the expert hand, because patient and patient relative, if they see that even with 2 pricks, cannulation is done, not done, they get very, very upset. That's why we have the project, 1 prick success percentage, how much we have done within 1 prick patient's cannulation. So it's very important topic you have discussed today, very essential. Many, many people have joined. I can see here 114 already, maybe might be many more, because some groups are in a boardroom are sitting with the for this webinar. So I am sure maybe more than 200 people have participated. So thank you, Pooja, for conducting such a, brilliant webinar every month. Colonel Binu Madam has spoken also about the INS
the progress and what all INS does with the certification course and all. So we always encourage nurses to take up those small courses and make yourself strong in cannulation and all the IV safety practices that are required. And I'm sure this all the hospitals-based healthcare organization in Odisha will take up the Infuse certification program. In future, many have already done it, and rest all will take up so that you can improve your standard of practices related to infusion therapy in the organization. Thank you very much. Well done, team. Very well done. Kudos to all of you. Excellent.
Thank you so much.
Excellent.
Good afternoon, ma'am. Thank you so much
Thank you so
for
much.
addressing the gathering, ma'am.
Thank you. Thank you.
It was like Odisha chapter. We are also very fortunate to get this chance in March in Ivy Talk. And our team, all the leaders from Odisha, ma'am, it is not only hospitals, all the colleges, maximum colleges are also joined in this topic.
Exactly.
Yes, ma'am. As I already earlier I told that there are some administrators, some doctors, they have also joined. So it was we are so lucky that we got many participants from those sides. And Colonel Binu ma'am also told, Madhukuri ma'am also addressed. And thanks, you also joined. We are also waiting for you. Thank you so much, ma'am. And we got this opportunity thanks to Miss Pooja also, that she has all the way helped us and managed to give us this session in March. Thank you so
And
much.
thank you for sending all the, communication for iMeals. Thank you all. I received. Me and Pooja and Ishita, we are working on it. And we will try our best to incorporate everything. All right?
Yes, ma'am. Yes, ma'am.
Thank you.
you.
Thank you. So that's the end, I think. Pooja, we can log off.
Just vote of thanks, I think. The last
Yes,
session.
yes.
Vote of thanks. The Miss N. Isa, the CNO, Chief of Nursing Services of which hospital? From some Ultimate Medicare Hospital. Madam is there. So kindly propose the vote of thanks of today's session.
I'm very delighted to give a vote of thanks on this big event, I can say. As we are people from Odisha, it is a cheerful team. Whenever something is done, we are there ready to do our shows. Yes. So kudos to Odisha team INS. And a big thank you to Colonel Binu madam, along with Madhukari ma'am. Dolly ma'am also joined. And without INS and without Polymed, we would have not done this IV talk. Thank you, Pooja, for asking each and every small detail about what can be done even with the email IDs. So without your support, we would have not done this program. As somebody mentioned, there are only 200 members. No, we blocked 3 halls. It is more than 350 alone from some Ultimate Medicare. I want to repeat, there are 350 nursing officers only from some Ultimate Medicare who has attended the program. So a big thank you to Chair INS Odisha, Ms. Shobha Manjari Samal, Co-Chair Saudamini. Saudamini, your presentation was simple and crispy. I liked it. And Sucharita, each and every standard was like a Bible or Quran or Bhagavad Gita to me. I have taken a note of it, which standard we should go through again. It is for those who have learned, and for those who have not relearned, again we'll be able to relearn. And Dr. Soumya Mishra, as because ma'am is from pediatric core group, really thank you from my bottom of my heart to say about the success and so on. And it is one Padmavati who is from some Ultimate Medicare group. As usual, she was rocking. Thank you for stick bundle, and she very clearly explained about VIP bundle and how to take care. I think I have covered everybody. Suppose if I would have missed anyone, sorry, Suvashri DNS from IMS and some. As because her core area was pediatrics, I think each and every line she was like speaking like a pediatric nurse. So that courage should be within everybody. A nurse is a nurse is a nurse who can relate her core topic whenever it is to the platform. So thank you all. So we like to get more opportunities for our IV talks in future. Thank you, Pooja. Thank you all.
And I think we had more than 800 participants registered, more than 800. So as Binu ma'am have already mentioned that this was the largest number who has registered for this IV talk.
Absolutely, ma'am. Absolutely. I would also like to mention Miss Ipshita here and Anki, of course, from the team. Anki is not well, but she's been contributing backstage, and Ipshita
Yes,
has
yes.
been there as a backbone for IV
I
Talks.
just want to interfere here. Not only Miss Pooja, her team like Siddharth, Akhi, she's sick and she's coordinating. In between, she's calling me also, ma'am, have you joined? Have you joined? Like that. It is the enthusiasm, it is the eagerness how she has shown, and the team effort was so good. And when you said that it is in the month of March, I was really felt very honored that we got this in month of March. We are expecting on September or October. Thank you so much for giving us this opportunity. It is not only you, it is the INS India leaders like Colonel Binu ma'am and Madhukuri ma'am. All of them have also very like Binu ma'am already spoken that the Odisha team is rocking now. So we are, whatever we do, we are rocking. Aisa madam has told something given to us, we are on the, like we are going to just run like that in such a way. So all the leaders of Bhubaneswar, so you can see my nursing superintendent, Mrs. Minati ma'am, Sucharita ma'am, and Saudamini, Aisa ma'am, all the senior leaders are very enthusiastic and very knowledgeable, very experienced. And a special thanks to Soma ma'am that she has from pediatrics, as Aisa madam has already mentioned, and she is also sitting from 2 o'clock with us and discussing with us from last few days. So thank you so much, and thank you all the team, and thank you everyone for registered for the Odisha and making this an a memorable one. Thank you.
Thank you all. We will look forward for the next IV Talks in the month of April. It is again with a new chapter. It is with the CG Chhattisgarh chapter in association with MP chapter. So we look forward for all of you to be there in the next IV Talk. Till then, we'll take a sign off. Thank you to all the speakers from Ipshita, my side, and Dr. Atul Sharma's side. I'm signing off from Polymed side. Thank you. Thank you, everyone.
Thank you.
Thank you so much.
Thank
you, Polymed, and thank you, Dr. Atul.
Dr. Atul, I did not
My
able
regards.
to see him.
Thank you to Dr. Atul, Ms. Pooja, and team.
Thank you all. Thank you. Shall we log off now?
Yes, yes, ma'am.
Thank you
I'll
so
end the
much.
event officially. Bye-bye.
Thank
Bye.
you.
Bye,
Thank you,
everyone.
dear. Thank you.
Thank you.
Bye. Bye.